Hi everyone, I'm Michael Uriarty, or Dr. Mike, and welcome to the MYK System channel. This is episode 2 in our series of comparing and contrasting other techniques with the MYK system. Today, we're going to talk about SOT, which stands for Sacro Occipital Technique. We'll give a brief history and description of what I could find about this technique, and then we'll cover the similarities and the differences to the MYK system. If you want more information on either technique, I have the website links in the description below. Whether you're a patient looking to get help or a practitioner looking for a good technique to learn, this series is for you. Let's dive in. What is SOT? The Sacro Occipital Technique was originally formulated. Formulated, that's a different way to say it. I mean, most people say founded or developed, but they said formulated. I like it. I like formulated, okay? So it was formulated by Major Bertrand Desjarnais. He was not in the military. Major was actually the name that his mother gave him. So Major. He was born in 1899. Wow. For the younger people out there, 1899 seems like a long time ago. For some of us, 1899, well, yeah, still pretty long ago. All right. So in 1918, little history lesson real quick, 1918, he decided that he was going to move to Detroit, and 1918 happened to be the end of World War I. So just so you know when we're talking about. So in 1918, he went to Detroit to pursue a career in the automobile industry, because around that time, everybody was done with the horses. They're like, you know what? By golly, I'm going to get in a car. And so that's what he decided. So one day he's working in the factory, right? Just doing his job. And all of a sudden, the factory blew up. Kaboom! This was back before we had like unions, back before we had OSHA. We had some safety standards. So anyway, the factory explodes and it leaves him severely crippled. And he heard that osteopathy may help. So he looked into it and he found out that students got free care. So, of course, he signed up to be a student. So he graduated from osteopathic school and he was better, but he still had back pain. And he met a chiropractor. And the chiropractor was like, dude, listen, you need to get adjusted to get rid of your back pain. So he looked into chiropractic school, and what do you know? If you go to school, students get free care. So, of course, he went and signed up to be a chiropractor. So now he graduates. He's both a chiropractor and an osteopath, but he still felt like something was missing. He was looking around for another school. Okay, no, I just kind of threw that out there. But it would make sense based on what he's done so far, right? So he decided to do his own studying and research and developed methods of correcting the cranium, the pelvis, the extremities, and the organs. And he found a pattern between the sacrum and the occiput, and thus the name of the technique. Pretty cool, yeah. All right, so let's look into the theory and the philosophy of SOT. Sacro is relating to the sacrum, and they say the sacrum is the foundation of the spine. In layman's terms, the sacrum is the tailbone. Occipital is relating to the occiput. The occiput is the back of the head. So traditionally, SOT is a method of normalizing the relationship between the foundation of the spine, the sacrum, and the top of the spine, the occiput, according to them. It is this relationship and how these two bones get along with one another that has proven to be so important in the normal functioning of the brain and the spinal cord. Now, all of this is from their information, right? This is their theory and the philosophy. It's designed to reduce or eliminate pain or disorders in the cranial, sacral, TMJ, head, neck, back, pelvis, and extremities. The extremities is everything down your arms and your legs. and in specific cases, improve organ function. So Major discovered that there are basically 3 categories of patterns of imbalance, and he developed indicators, location, and correction of these patterns, along with before and after test to see if the care was needed or if it was actually successful. So the patterns are, category 1. So there's 3 categories. Category 1, this deals with the primary respiratory mechanism between the sacrum and the occiput. Not actually breathing, but how these two things flow, It's described as the a pelvic torsion with limited sacral nutation. Let me jump in and use some normal language because that's the way I like to teach. I don't like to talk in words that nobody knows or hears very often. So this is his definition again, and I'm just going to use different words. So pelvic torsion is a twisting of the pelvis, and he says this makes one leg look shorter than the other, and limited sacral nutation is movement of the tailbone or lack thereof. So limited movement of the sacrum. The respiratory mechanism is not breathing, again, with our lungs. We have a covering around our brain and spinal cord called the meninges. We can break this down even further and say dura mater, arachnoid, and pia mater. So when your sacrum is fixed with this lack of movement, there's a tension on the meningeal attachments that run from the tailbone up to the head. And there's a fluid inside. And this is called the cerebrospinal fluid. And because of this tension, it doesn't flow like it should. Okay, so that's a category 1. The pelvis and the tailbone are kind of locked up, twisted and locked up. Category 2 type person. There's too much motion. So now instead of being locked up, this person's like all willy-nilly all over the place. So there's too much motion or instability between the tailbone and the pelvis. It's common with this imbalance to find a low back imbalance, which can affect the knees, the shoulders, the neck, and the TMJ. So if you don't take care of a category 2 person, it's going to lead to a category 3 person. So category 3, this is severe back pain relating to sciatica or disc herniations. So patients can have difficulty standing up, or they may be leaning over to one side. It'll hurt to cough or sneeze, stand up from a seated position, even putting on your shoes. And you may even have numbness and tingling in the legs. So there's the 3 different categories that he would put someone in, or that an SOT practitioner would put you in. So who should consider getting an SOT treatment? So the primary focus of an SOT practitioner is the cranial sacral respiratory mechanism. There's a wave-like oscillation in the covering of the brain and the spinal cord, and it pumps the fluid up and down. And if this is not normal, they say functions in the body won't be normal. It is similar to other chiropractic techniques. So SOT will also correct abnormal spinal mechanics and any associated nerve problems like headaches, back pain, dizziness, arm and leg pain, things like that. By using, they call it CMRT, which is chiropractic manipulative reflex techniques. Wow. I'll have to go back and look into this as far as chiropractic manipulative reflex techniques. But by using this CMRT, your SOT practitioner can normalize organ function, such as, now this is again from their website, high blood pressure, digestive problems, urinary problems, toxicity, female reproductive dysfunction, the list goes on. And it does. Here's more: TMJ, tinnitus, headaches, visual disturbances, ear infections. Okay, you get the idea. Will it make the pain go away? Getting rid of pain is important, and patient comfort is considered. But eliminating or killing the pain, ooh, I like that. Well, we're going to go in and we're going to kill that pain. All right, so eliminating or killing the pain is not the main goal. Oh, okay. They want to normalize the function of the entire body. I like that. I do like that. Elimination of pain is simply a side effect of normalizing the cranial sacral respiratory mechanism. Okay, I can buy into that. I like that approach. We actually want to accomplish this, and then it's going to have the side effect is all the pain goes away and you feel better and all that kind of stuff. I like it. All right. What does the practitioner actually do? So when you go in, what's the patient going to receive? What's the patient do? And what's the practitioner do? So I was actually able to find a video of a doctor performing an evaluation, and the patient is lying prone or on their stomach, and the doctor is checking their leg lengths. He has the patient do movements with their arm and their head, and he's looking at their leg lengths. He then palpates the hips and the low back and checks the leg length movements. From these different tests, he's able to put the patient into one of these 3 different categories. During an SOT treatment, blocks or wedges are positioned delicately, they say, and precisely under the pelvis to realign the head, the spine, and the pelvis. The patient's body weight, combined with gentle pressure from the doctor in the appropriate areas, will help to steadily realign these essential components of the body, thus restoring comfort to the patient. All right, that's a different approach. It's a different approach from a normal chiropractic treatment, because normally you go in and they're adjusting and moving and things like this. So this is using your own body weight. So kind of cool idea. The average SOT treatment is about 15 minutes. I do like that. Let's talk about continuing education. I couldn't find information on what professions SOT provides CEUs for. I do know that it provides CEUs for chiropractors. I'm not sure about the other professions. If you know any other professions that SOT provides CEUs for, let me know. Put it in the comments below. So right now I'm just going to stick with chiropractors because that's what I know. All right, let's talk about cost of the class. They have SOT Part 1 and Part 2, and then they have the CMRT classes, and these are 12-hour classes, and they run about $800 for a member and $900 for a non-member. And to become a member of the SOT organization, it costs about $150. And I don't know if that's a one-time fee, if it's a yearly fee, or what that is. So a 12-hour class is about $800. Okay. What are the similarities and the differences between SOT and the MYK system? So one similarity is the quickness of the treatments. SOT says it takes about 15 minutes, and the MYK system, depending on the nerve level, is anywhere from 3 to about 15 minutes. Here's a difference. The assessment is very different in each technique. With SOT, you are put into one of 3 categories by checking the leg lengths and having the patient move their arms, head, legs, and also palpating the hips and the low back. With the MYK system, we do a postural analysis, looking at the postural imbalances, and it's like a checklist. And we're able to narrow down to a nerve problem just based on checking, and then you just kind of add it up, and you go, oh, look at this, all this kind of goes into, this nerve. And then we're ready to do a treatment. The treatment themselves are different as well. SOT uses blocks for the hips, and they probably will adjust along the spine as well with that CMRT. The MYK system does passive and active movements while we stimulate each muscle along one nerve pathway on both sides of the body so that we can impact one nerve. The MYK system does not move bones. It's purely a soft tissue technique. SOT is kind of, the way I'm kind of looking at that with the blocks and everything, is kind of a mixture. Because using the blocks and everything, you're kind of, the pressure and all that, you're kind of influencing the soft tissue from that standpoint, and then along with the bones, but then also they'll get in and move it. All right, so something that is similar between the two is one aspect of the treatments is kind of the same. And both of these treatments are low impact or no impact, because with SOT blocking, it's using your body weight to help make the changes. And with the MYK system, it's purely just a soft tissue treatment. The theory and the philosophy, different as well. So SOT is looking to clear up the flow of the cerebrospinal fluid between the brain, along the spine, down into the sacrum. With the MYK system, we're getting all the muscles on one nerve pathway to send a signal up to the brain, with a few of those muscles saying, hey, I'm in a new position to gravity. And the brain says, wow, all of these muscles just got to change. Now, all these other muscles that we never even touched are going to contract or relax based on that change. And what happens is the person stands up, and then we'll start to see balancing of the posture, pain goes away, range of motion goes up. And this usually happens pretty darn quick. So you'll usually see postural changes as soon as they stand up. And the patient usually notices a difference that quick as well. Symptoms that we treat are pretty similar between the two. So we both go after the same thing, because they say that they go after some organ stuff as well. So does the MYK system. So we go after the headaches and the plantar fasciitis and all those kind of things, along with some of the organ stuff. So there's a difference in the professions that we teach. Again, I could only find that SOT is primarily just for the chiropractors. Again, if you know different, let me know. The MYK system, we teach the physical therapy profession, PTs and PTAs, the occupational therapy profession, OTs and OTAs, the massage therapist, athletic trainers, personal trainers, chiropractors, nurses. So we've got a number of different ones that we can teach. And the cost of the class are also different. So to go through the 44-hour certification class is $2,500. And I broke it down. It's $56 an hour. So each 12-hour class, $800 or $900, is about $66 an hour per CEU. Not bad. Again, I'm looking at this going, man, I need to raise my rates. So the cost to get certified in the MYK system, it's 80 hours, not 44. It's an 80-hour certification, $3,100 or $39 an hour. SOT was $56 an hour to get certified. Each of our classes, upper and lower body class, is about $29 an hour versus their $66 an hour. Again, I'm looking at that going, I should probably raise my rates. Okay, but I won't. Okay. SOT, it does sound interesting. I got to say, it sounds, I've never had it done. I'm a chiropractor, and I've never been treated with the SOT treatment. So it does sound interesting. I do like the idea of getting the flow of the cerebrospinal fluid going from the head down to the tailbone and eliminating tension along the covering of the spine. I do like that, and it's definitely different from the MYK system. All right. One thing I want to ask, be sure and hit the subscribe button. I have more videos coming. If you made it this far, smile.